And this is the question the American public is asking. Why are we still allowing folks to come over here, and why, once they're over here, is there no quarantine?
That was Congressman Tim Murphy, a Republican and chair of the House Oversight Committee, speaking during a hearing Thursday on the administration's Ebola response. According to a tally by the Hill newspaper, Murphy is one of at least 60 lawmakers who wants to ban all travel to the United States from the Western African countries at the center of the Ebola outbreak. Now, some immigrants from West Africa are reporting that they are feeling stigmatized as people assume they have the deadly disease and keep their distance. Nearly 574,000 immigrants living in the U.S. today were born in West Africa. There are more than 71,000 West African immigrants in New York City alone. And as I touched on previously, immigrants of any region are among those with the least access to health care in this country. Back at the table is MSNBC host of the Reid Report, Joy Reid. And joining us now, Cecilia Fisher, Director of the Center for Ethics Education at Fordham University, and Dr. Althea Maybank, who is Associate Commissioner and Director for the Center of Health Equity at the New York City Department of Health and Mental Hygiene. And I understand, Dr. Maybank, that you have been in West African communities here in New York having conversations about exactly this topic.
Absolutely. You know, a big part of what could perpetuate Ebola in this country, if it happens to come to New York City especially, is fear, miscommunication, and misinformation. And so our job and our role is really making sure that everybody has access to accurate information. And so we really felt it was important that we took a step forward and reached out to all of our West African communities across New York City. And we've made hundreds of phone calls and emails and really got to get feedback from the sense of what's really happening, what are your concerns, and how best can we help you as a health department. And they've really helped us guide making the materials that we have done and put out in public, whatever they are. And so it's important that we have their voices, we uplift their voices, and we understand what's there. And the feedback that we're getting, as was mentioned, is this discrimination is mounting. We hear, you know, taxi drivers who are saying they're not able to pick up folks. People aren't going into their cars, which means then that has an economic impact as well, because now they don't have businesses, and they're saying now they cannot send this money back home to their family. So there's a whole trickle effect, and it's imperative that we really put out there that this is a human tragedy. It doesn't have biases. It doesn't have a pass for Ebola, and it can affect us all.
So on the one hand, Ebola itself as a virus does not have biases, obviously, but part of what I wanted to get to, Celia, is this idea that infectious disease helps to remind us that the biases that are already pre-existing in our system make all of us vulnerable. So we can't close off participation of people in a global economy. People are going to go back and forth. They're going to visit their families. West Africa is a part of the immigrant community here in the U.S. And yet, if we have this unfair health system, it does make all of us more vulnerable, not so much to Ebola, but to all of the crises.
Absolutely. And what psychologists have found, that when people's mortality is threatened, or they feel that it is threatened, they tend to run back to their embedded cultural communities and then use the other cultural community as a scapegoat, and to say things like, well, if only we stay away from them, we will control this kind of
threat creates bias.
Exactly. And as well as medical schools do not train healthcare professionals how to really deal with the discrimination, poverty, and other kinds of vulnerabilities that patients bring. And so you have this bias that runs through the medical profession that they may not even be aware of. And whether or not Mr. Duncan was a victim of that, we certainly know that that kind of prejudice reduces health care in this country.
Well, and I keep thinking, I've had all these experts who sit here and told me early on, well, don't worry, Melissa, because the reason that it's taking root in West Africa is because people don't trust the healthcare system, because it doesn't serve all. And I was like, hello.
And the same thing,
you know, go to the Delta of Mississippi. People don't trust the healthcare system, and it doesn't serve them.
And to that point, you know, we have a long-standing history of mistrust in this country towards the government, especially for communities of color, because there's a long-standing history that's well documented, plenty of evidence, books written about it from the Institute of Medicine, the Medical Apartheid, that document the history of exploitation of communities of color in this country. And so it is a real fear and a real mistrust of what can happen when you enter the system. And that's where, especially in this situation where protocols protocols become very important. Policies become very important, and training around them become very important to ensure that there is equal treatment of people. Now, granted, we know there are people, so how they actually utilize the policies and the training is one thing, but the best that we can do is making sure that folks are trained.
And Joy, we can't, we talked about the optics and the politics earlier. We just cannot get away from the optics and the racial politics that are associated with the fact that the only person to have died in this country of Ebola is a West African black man, and that the 2 nurses infected are both women of color. There is an optic to that undoubtedly could have some impact.
And it has impact in a negative way, too, because there's also the urban legends that are growing around on the interwebs, essentially blaming Thomas Eric Duncan for lying his way into the country, for bringing this pathogen, as if sort of the body of an African is itself kind of a weapon that he's using against us in some horrible way, when in fact this was a man who did trust the system. He went to the doctor and he had a fever. He was sent home with a 103 fever. That's not supposed to happen, whether it's the flu or whether it's well, that's just not supposed to happen. He was an uninsured person. That plays into it. So was he treated sort of in and out, sort of a catch and release because he wasn't insured, have some Tylenol and go home? That also plays a part in it. More than his being an African plays a part in it. It was the time it took to get him treated.
And then, but on the other hand, so I keep going back and forth there. There's a part of me that's like, well, you don't, treat and street people when you have a crisis and someone clearly presenting with, I've just been in a place where on the other hand, I don't want to quarantine every West African immigrant who appears in a hospital with the flu.
Well, and that's the problem and the challenge, the ethical challenge of public health, because public health is there to protect the community, not to protect individuals, and they have a challenge about whether or not quarantining, which takes away the liberty of individuals, should be balanced by protecting a larger population. And another thing is, in terms of the ban on air travel, there's this naive assumption that the germ itself causes the epidemic. Germs cause diseases. Poverty and lack of resources causes epidemics. And one of the problems is a ban is going to accrete just those factors that are going to make an epidemic become a pandemic.
Yep. Thank you. Joy is going to be back in our next hour. I want to say thank you to Dr. Celia Fisher, also to Dr. Althea Maybank.